Satu, dua, tiga. Hello everyone!
We're going to make some videos, but before we start, we would like to introduce ourselves. My name is Ezra Mareta.
My name is Mona Lisa Devera.
So here's the video. Check out!
Mental disorders are among the most significant public health challenges because they affect a person's emotional, psychological, social, and physical well-being. Effective psychiatric care requires a holistic approach that addresses biological, psychological, social, and spiritual needs. Nurses play a vital role in assessing this aspect and providing comprehensive care to improve patient overall quality of life. Patients with mental health disorders have the same legal rights as all other patients. They have the right to receive safe, respectful, and non-discriminatory health care, as well as the right to privacy, confidentiality, and informed decision-making whenever possible. However, psychiatric nurses often encounter complex situations, such as patients refusing treatment or exhibiting behavior that may put themselves or others at risk, requiring a careful professional judgment. Therefore, a strong understanding of legal and ethical principles is essential in psychiatric nursing. These principles guide nurses in making appropriate clinical decisions, protecting patient rights, and ensuring safe, effective, and comprehensive care. By applying legal knowledge together with ethical values such as respect, empathy, beneficence, and justice, nurses can provide professional mental health service while maintaining the dignity of well-being of every patient.
Explain the meaning of legal and ethics in psychiatric nursing. The first objective is understand the meaning of legal and ethic principles in psychiatric nursing. Legal aspect refer to the law and regulation that guide nursing practice, while ethics refers to the moral values and professional practice in helps nurse makes the right decision while caring for patient. Explain the legal business for providing service to patients with mental disorders. The second objective is to learn about the laws and regulations that protect the right of patients with mental disorders. Their legal foundation ensure that patients receive safe, fair, and appropriate healthcare service while protecting healthcare professionals in their practice. Explain the ethic principle of psychiatric nursing. The third objective is to understand the ethical principles applied in psychiatric nursing, such as autonomy, beneficency, non-maleficence, justice, confidentiality, and respect for human dignity. These principles help nurses provide comprehension and patient-centered care. Explain the application of legal and ethic aspects in nursing practice for patients with mental disorders. The fourth objective is understand how legal and ethic principles are applied in a real clinical situation. Nurse must protect patient rights, maintenance confidentiality, option informed consent whenever possible, and provide safe, professional, and ethical care. Analyze ethical dilemma and solve them through case studies. The final objective is to develop critical thinking and decision-making skills by analyzing ethical dilemmas through case studies. Students are expected to identify problems, evaluate possible situations, and choose the most appropriate action based on legal regulation and ethic principles.
Meaning of legal and ethic. Legal refers to the laws and regulations that govern nursing practice. These laws ensure that nurses provide safe, professional, and standardized care while protecting both patient and healthcare professionals. Examples including government laws, Ministry of Health regulation, nursing standards, and also hospital SOPs. Ethic refers to the moral or values and professional principles that guide nurses to making in the right decision. Ethical principles include respect for patient, dignity, honest, compassion, justice, and confidentiality. In conclusion, legal tells nurses what they must do according to the laws, while ethics guide them to do what is morally right. Together, they ensure safe, professional, and patient-centered psychiatric nursing care.
Legal basis for service for patients with mental disorders. The section explains that mental health service must be based on clear legal regulation to protect the right of patients with mental disorders. There's law service as guidelines for healthcare professionals to provide safe, fair, and professional care. The main legal foundation include first, the 1945 Constitution of Indonesia, which the guardians every citizen's right to healthcare and protect from discrimination. Second, Law Number 18 of 2014 on mental health, which ensures the right of people with mental disorder to receive mental health service, treatment, and rehabilitation. Law Number 44 of 2009 on hospitals, which is a regulation patient right and responsibility in healthcare facilities. Ministry of Health Regulation Number 77 of 2015, which provides guidance for mental health service. Ministry of Health Regulation Number 54 of 2017, which is focused on preventing and eliminating the practice of physical restraint for people with mental disorders. In conclusion, there's legal regulation ensure that patients with mental disorder receive safe, high-quality healthcare while protecting their rights, dignity, and legal protection.
Rights of patients with mental disorders. Will this section explain that patients with mental disorders have the same right as every other patient? Their rights must always be respected, protected, and fulfilled throughout the healthcare process. The first right is to the safe, quality, and non-discriminatory healthcare service. Every patient deserves appropriate treatment regardless of their mental condition. This section is protect from violence, neglect, and restraint, and exploitation. Healthcare provider and family must ensure that patients are treated with dignity and respect. The third right is the right to receive clear information and give informed consent according to the patient condition and decision-making capacity. Patients should understand their treatment whenever possible. The fourth right is to the right of the treatment, rehabilitation, and recovery service based on their individual needs. Mental health care should support patients in achieving and best possible recovery. Finally, patients have the right to equal treatment, respect their dignity, and legal protection. Every person deserves to be treated fairly and have their human rights protected. In conclusion, respecting and protecting this right is essential to providing ethical, legal, and patient-centered psychiatric nurse care.
Nursing ethic principles for patients with mental disorders. The section explains the ethical principles that guide nurses in providing safe, respectful, and professional care for patients with mental disorders. The first principle is autonomy, which means respecting the patient's right to make decisions according to their decision-making capacity. The second principle is beneficency, which means nurses should be always act on patient best interests and promote their health and well-being. The third principle is non-maleficence, all do not harm, which is reminds nurse to avoid any action and could harm the patient. The next principle are justice, which means providing fair and non-discriminatory care to every patient variety, which requires nurse to provide honest and accurate information, and confidentiality, which means protecting the patient privacy and personal health information.
Application of ethical principle in mental health nursing. This section explains how ethical principles are applied in daily mental health nursing practice. Nurses must not only understand ethical principles, but also apply them in every interaction with patient. First, nurses should respect every patient, even when they show challenging or disrupting behavior. Second, nurses must maintain patient confidentiality by protecting personal or medical information. Third, nurses should provide education and support to both patients with their families so they can better understand the patient condition and treatment. In addition, nurses must avoid any form of physical or verbal abuse and always treat patients with dignity and compassion. When patients are unable to make decisions on their own, nurses should involve family members or legal guardians to the decision-making process while they're respecting the patient right as much as possible.
Legal aspect in mental health nursing practice. The section explains the legal responsibility of nurse in mental health practice. Nurse must follow legal regulation to protect patient rights while providing safe and professional care. First, nurse should option informed consent before approving treatment whenever the patient has the capacity to make discussion. Second, they must protect patient confidentiality by sharing professional information with patient concerned or when required by the law. In addition, nurse should respect patient rights, include their right to receive information, refuse treatment, and treat with dignity. Nurses are also responsible for maintaining accurate and complete documentation of patient assessment, invitation, and progress. Finally, restraint or seclusion should only be used when legally justice and according hospital policy and applicable laws.
Ethical dilemmas in mental health nursing. This section discusses the ethical dilemmas that nurses may face when caring for patients with mental disorder. An ethical dilemma occurs when two or more ethical principles conflict, making it difficult to decide the best course of action. One common dilemma is anatomy versus patient safety. Nurses must respect the patient's right to make decisions while also protecting them from harm. Another dilemma is confidentiality versus the duty of war, when nurses must balance with patient privacy with the responsibility to protect others if there's any serious risk. Other challenges include involuntary treatment, which may be necessary when a patient refuses care but poses a danger to themselves or others, and to use the restraint of such solution, which should only be used as the last resort and according to legal and ethical standards. Nurses also need to balance family involvement with the patient privacy, preference, and legal rights.
Resolving ethic dilemmas in mental health nursing. This section explains the steps nursing should take to resolve ethic dilemmas in mental health nursing. A systematic approach helps nursing make a discussion that are ethic, legal, and patient-centered. The first step is to identify the ethical problem by clearly understanding a situation and ethical issue involved. Next, nurse should gather relevant information, including the patient condition, clinical data, and applicable laws or hospital policy. After that, nursing need to consider ethic principles such as autonomy, beneficence, non-maleficence, justice, and respect for human dignity. They should also consult with the healthcare team, supervisor, and ethic committee when necessary to option different perspective and support. Finally, nurse should make the implement the best discussion, evaluate the outcome, and documentation the entire process accurately, accountability, and helps improving future discussion making.
The role of nurses in mental health care. This section explains the important roles of nurses in providing comprehensive mental health care. Nurses are not only caregivers but also advocates, educators, communication, collaborators, and protectors of patients' rights. As caregiver, nurses provide holistic care to meet patient physical, psychological, social, and emotional needs. As patient advocates, they protect patients' right, support informed decision making, and ensure that care is ethical and fair. Nurses also act as educators by teaching patients and their families about mental health condition, treatment plans, medication, and recovery strategies. In addition, nurses serve as communicators, building therapeutic relationships through active listening, empathy, and effective communication. They also work as collaborators, cooperating with psychiatrists, psychologists, social workers, and also healthcare professionals to provide comprehensive care. Finally, nurses are protectors for patient rights, safeguarding patient dignity, privacy, confidentiality, and legal rights throughout the care process.
Conclusion: mental health nursing. In conclusion, legal and ethical aspects are the foundation of mental health nursing. They guide nursing and provide safe, respectful, and professional care while protecting patient rights and dignity. Nurse must understand legal regulation, ethical principles, and professional responsibilities to make appropriate clinical discussion. Ethical dilemmas are common in mental health nursing, so nurses need critical thinking, good judgmental, and effective communication to resolve them. In addition, nurses have many important roles, including being caregivers, patient advocates, educators, communicators, collaboration, and protectors of patient rights. By applying legal and ethical principles in everyday practice, nurses can promote recovery, improve patient quality of life, and provide safe, high quality, and patient-centered mental health care.